The 1980s and 90s saw tremendous growth in the numbers of accredited physician assistant programs, students enrolled, and women entering the profession. And these decades saw steady growth in the acceptance of PAs as important members of healthcare teams. But even in the early 1980s, there still was lingering resistance.
When I first got out of PA school, I remember being in an orthopedic job and I was suturing a patient in the emergency department, and the chief nurse of the hospital came in and tried to throw me out and agreed to let me stay since I was in the middle of this suture job.
Edery worked to help change the perception of PAs early in her career by becoming active on various committees within the American Academy of Physician Assistants.
I was very apolitical until I started PA school at Duke. So while we were students, interest in being active both on a state and national level was encouraged, and I became really jazzed about it.
She chaired numerous committees of the AAPA, became an officer in the House of Delegates, was elected president of the Physician Assistant Foundation, and from 2006 to 2007, she served as president of the AAPA and is credited with directing a sea change with how the Academy was run. This helped to set the course for the organization's future success.
We felt we needed to, if you will, shake things up a bit. And there were a lot of painful years, but when you look back now and see where the Academy has come, the number of PAs still being produced and finding jobs, the importance of the PA profession, I think we started a good wave.
As president of the organization, Edery lobbied Congress, the American Medical Association, and other key groups about the importance of the PA profession in the changing world of healthcare. She traveled extensively to state meetings, promoting membership and educating colleagues about the organization's initiatives.
We're such a small profession that it's still possible to know a lot of people, and one person can still really make a difference and drive change.
Though retired as a full-time physician assistant, Edery is still politically and professionally active. She currently serves as the official AAPA liaison to the American Medical Association and is an officer in the Florida chapter of the AAPA. She volunteers at the Volunteers in Medicine Community Clinic in Stuart, Florida, about 40 miles outside of West Palm Beach.
Most of our clinicians are volunteer. We have both nurse practitioners and PAs, and also physicians at this clinic. And quite honestly, the majority of the care and the stability of the care is by a number of nurse practitioners and myself and another PA. We don't have illusions about ourselves being in charge of anything. We're all members of the team, and we embrace that team concept. That's the most critical part of being a PA. It's all about the team with whom you function and how that team enhances healthcare.
My name is Lisa Varnes-Epstein. I am a physician assistant and a licensed midwife. I work at the Lafarge Medical Clinic here in Lafarge, Wisconsin. I knew from the beginning that I was going to be working in rural medicine and in underserved areas, so that was never a question to me. It was just a matter of where I was going to land. There's no way we would be able to serve the number of people needing health care services without the mid-level providers being willing to come out to these areas and serve in that capacity.
Long before settling in rural Wisconsin, Varnes-Epstein was a National Health Service Corps scholar, and for 2 years following graduation from PA school at Duke, she was charged with opening and running a clinic in rural Terralingua, Texas.
But it was not even rural medicine, it was considered frontier medicine. West Texas, next to the Big Bend, is roughly about 2,000 square miles of nothing. It's not a destination place for a lot of people. It's not on the way to somewhere else. They said, we are willing to have you come and be the director of this clinic, and we need you to hire somebody from the community who knows how to turn on a computer, and we'll teach them the rest, and you will be the sole provider in this clinic.
For the mid-1990s, this was a powerful testament to the value and trust that the medical profession was now placing in physician assistants.
I feel very strongly that the reason I could do it is because I came from Duke, and I came from a very, very rigorous PA program that allowed me an enormous amount of hands-on learning, experiential learning in all of my rotation, my clinical sites. And I could take that and immediately apply it.
More recently, Varnes-Epstein took her skills to Sierra Leone, where in early 2015, she spent 6 weeks working with an umbrella organization of Partners in Health.
We've got this Ebola crisis, and Sierra Leone at this point is the hardest hit country with the most number of cases every day. This is a situation, this is a crisis that doesn't really require soldiers, it requires medical people to stand up and to volunteer and to put themselves forward and address that situation. That's what we need. We have to embrace the idea of using the full scope of our knowledge and our clinical competence to fill in the gaps that we have in the healthcare system in the States.